Hi, I'm Dr. Alexis Colvin. I'm an orthopedic surgeon at Mount Sinai Hospital, and this is the Doctors In with Flow Space. One of the most amazing parts of our body is the skeletal system, our bones. Bones are a living part of our body, which means that bones are forming and then also removing the old bone that we're not using anymore. So the process of bones forming and then bones removing goes on through our whole life. When you're in your teens through your 20s, you're making bone faster than you're removing it. As we get into our 30s, that process becomes more of an even balance between bones forming and bones being removed, and you don't really build bone density after about age 30, unfortunately. So it's critical that when we're in our teens and 20s, that we're actually trying to build up our peak bone mass, as much bone density as possible. If you're over age 30, don't worry. Doing weight-bearing exercise can actually help you maintain bone density. And so weight-bearing exercise in the form of walking, dancing, jogging, tennis, pickleball, anything where you're using your body weight will help stimulate bones to maintain that bone mass. This is incredibly critical once we get into the perimenopausal ages, because as estrogen decreases in a woman's body, that also will reduce bone density. So you really want to keep up that weight-bearing exercise through the rest of your life. The most important thing as women move into perimenopausal stages of life is consistency in terms of an exercise program. If you really have not exercised a day in your life, but now you realize the importance of it, don't fret. Start slowly, find a group to do it with, find a trainer to get some instruction. The most important thing is staying consistent and starting small. Every great program starts with small steps to get there, and just doing a little bit each day really does accumulate, and every little bit is really going to go towards this overall part of making you stronger and fitter in your 50s, 60s, 70s than you could imagine. 3 strength exercises that I would recommend all women do are: number 1, walking. Walking in and of itself is a great weight-bearing exercise that is going to help strengthen your lower body and give you that aerobic benefit. Number 2 is working on strengthening your core. So that could be in the form of planks, sit-ups, anything where you're going to help support the trunk muscles of your body. And then number 3 would be any sort of upper body resistant exercise, so that we really get the whole body. And it doesn't have to be complicated. A set of free weights, resistance bands, push-ups, pull-ups. You don't need fancy equipment, but you do need consistency. And if you don't really know what you're doing, probably a little bit of education, either from a physical therapist or a personal trainer. If you are feeling stiff throughout the day as you're getting older, it's not necessarily your imagination. As we get older, we start to lose water from our tendons, our ligaments, our joints, and that all contributes to feeling stiffness. The good news is the remedy for that actually is exercise. So repetitive, low-impact exercise actually will help stimulate your joints to make its own natural motor oil and help keep your joints lubricated and feeling less stiff. If you are an avid pickleball or tennis player, the number 1 thing I would recommend to do to prevent injury is to cross-train. If you look at any professional athlete, no matter what the sport, they don't spend all the time on the court, in the swimming pool, on the track. What they do with their sport is equally as important as what they do outside of their sport. So what does cross-training mean? So that means working on your aerobic capacity. So that's with low-impact cardiovascular activities such as running, jogging, walking, the elliptical. Strength training, again, the strength training to help maintain your bone density, but also to help you make those shots. Number 3 is flexibility. So either yoga, stretching, balance through Tai Chi, all those combined, that cross-training is really going to make you a better athlete for tennis and pickleball, but also just a better athlete for life. One customizable balance exercise that's easy to do would be getting up from a chair without using your hands. That's a great way to use your core and your balance in a safe way, and you can then add on to it by doing it one-legged, adding a weight, or if that's too complicated, taking it back a step and using, for instance, TRX straps to help you get out of the chair until you can use your own strength to do that.